WD offers independent outpatient providers the only electronic health record that uses quick quality care documentation to produce bulletproof automated claims. A free novel AI-enhanced patient portal completes WD Outpatient, providing patients the power to schedule visits, read visit summaries, and receive screening recommendations to significantly improve adherence to and engagement in care. Let's see a patient. Having surveyed the medical record, the provider calls the patient into the room to talk and to examine. This leads the provider to a diagnosis, which the provider locates within WD's library of over 225 evidence-based checklists. Checklists in the WD system serve as a clinical backstop as well as a vehicle for clinical action. This patient describes vertigo. Every time the patient turns his head to the left, the room spins and he vomits, but otherwise there aren't other associated symptoms, including confusion or fever. It's been a while, so the provider reads the background on vertigo. Benign paroxysmal positional vertigo is the most common cause of vertigo, responsible for over 50% of cases. Next, the provider skims the differential diagnosis. This may be another condition, such as stroke. To verify the diagnosis, the provider goes through the checklist, clicking what applies. This instantaneously writes the medical note, confirms through signaling the diagnosis over others, and reminds the provider that this is a clinical diagnosis and not to perform wasteful laboratory tests. The checklist treatment section is as prescriptive. A link to a maneuver called Epley lays out easily forgotten steps. The provider, after review, performs the maneuver and the patient gets better. But the quality treatment rectangle remains red. Clicking on the metric reveals why. The provider has forgotten to record the treatment. Similarly, watch the patient education quality indicator turn green once all discharge instructions are completed. It's almost time to close the visit. AI-enhanced analysis of provider checklist selections determines the most accurate diagnosis from tens of thousands of ICD-10 codes. Back-end scoring of checklist elements quantifies actual work involved in evaluating and managing the patient. This derives a CPT-EM code, the key determinant of reimbursement. Closing the chart automatically sends a case claim to the patient's insurance plan. The remittance will appear as paid in WD Outpatient's Claims Manager 98% of the time. No more need for office staff devoted to claims assembly and reconciliation. This is WD Outpatient, an EHR that protects independent doctors through quality claims submission and care.